All right, so we're going to talk about complications in implant dentistry and specifically complications in prosthodontics. Complications can occur in many different ways. The biggest complication that we started out thinking about in implant dentistry, and the one that's most well documented, is a failure of an implant to integrate. Or, in my opinion, worse than failure of an implant to integrate is an implant that integrates, we make a restoration, the patient's happy, and then 6 months or a year down the line, for no apparent reason, the implant fails. That's a loss of integration. We've got some new terms that we might apply to that, but we'll get to those eventually. Implant fracture is an even worse complication, because if you have an implant that's in function for a few years, the patient's happy with it, and then all of a sudden the implant fractures, now not only do we have a failed site, but now we have to create a bigger defect to remove that portion of the implant that remains in the bone, because there's a portion of the implant that's still integrated. So now we started out with a problem, a missing tooth. We've solved the problem with an implant-supported restoration. Then the implant fractures. Now we create a bigger problem. Now we're looking at grafting. We're looking at site development to fix the situation. Those are probably the things that we think of most when we're thinking about implants, because fortunately we're looking at a solution that works 95, 96, 97% of the time, in my practice at least. We have other failures. We have soft tissue reactions that are adverse. We have material failures, we have bone loss, and we have tissue recession.